Okay, Anna, keep looking. Okay, we're getting ready now.
Okay.
Okay, so what I'm going to do now is I am going to admit the people in the room.
Okay.
Oh, come on now. Hmm. Control, access. Admit all. There we go. And then let's close that. And let's record. Beautiful. All yours, Ayanna.
Very, very good day, everyone. Welcome and thank you for joining us. This is our very, very first time. This is our first time doing our live. We are coming to you as the Neuro-Wellness Collaborative. We thank you so much for your patience. And, technology is wonderful if it works. And we have been preparing to engage with you. But of course, because we have prepared to engage with you, we've had technical difficulties this morning or this evening, where depending on where you are around the world, and it kind of delayed our start. We hope that you will forgive us and not hold that against us. We have joining us today not only you, our very special guest, but we have Dr. Kiti Adderley, we have Dr. Wail Salam, and I am Dr. Ayanna Miller. We are a group of international doctors of physical therapy. We are not tech gurus, but we are specialists in neuro and wellness. And so this forum is where we engage with you guys on things dealing with wellness, prevention, function, and things, topics related to supporting your functional mobility and keeping you well. So we want to know where you guys are from. Can you tell us where you're located? Uh, Again, we apologize for keeping you waiting. You must be so weary, but we'd like to hear who you are and where you're from. Give us an idea of where you're located. If you could just pop it in the chat, we'd like to hear from you. Where are you guys? Where is everyone from? Oh, Southern California. I was in Nassau, Bahamas. Welcome. Sister Miller, I wonder if we're cousins. A lot of Millers in Nassau, right? I was just in San Jose on bereavement. We have someone joining from Cairo. Welcome. Very, very warm welcome to everyone. CM, AM, nice to have you all joining us. Anybody else? I don't see another name here. Okay. Well, we thank you for joining us once again, and very warm welcome to you all. Today, let's talk about that part of the body that pretty much is responsible for carrying everything, but yet it rarely gets the care that it deserves. And I'm speaking of your back. Today, we're talking about adult back care. And it doesn't matter whether you're a desk jockey, a person who sits at a desk all day long, or whether you're a person who is just trying to make it through the day without moaning and groaning. You know, you've got back issues that are currently plaguing you. It doesn't matter whether you're a weekend warrior or somebody who decides, hey, you know, I want to go out and get fit today and I'm going to do everything in one day. You know, back pain doesn't discriminate. It does not have any favorites, and it can affect anyone. So one of the most common complaints that I find across all settings and in operating rooms, even for people who have to have surgery, is that of back pain. And yet it's relatively misunderstood. People don't always know the root cause of their back pain or how to control it or where it even came from. So today we're hoping to discuss with you some ways of preventing having back pain, how you can restore functional movement if you're currently dealing with back issues, and understanding the role that posture plays, that mobility plays, that stress plays, that inactivity plays, that even your gut health plays in this, in this silent, immobilizing pathology. These factors can silently accumulate to lead to immobility and dysfunction. So we want to kind of deal with your back today and recognize that it's the power column of your body. It pretty much attaches everything, all of your appendages, your arms, your legs, your neck and your head, everything attaches into the back. But also you have internal organs that are closely attached with your back as well. And this has an effect on your mobility and your nervous system. So we'll cut past the gimmicks and try to get right into a discussion of some concepts that will kind of connect the dots for you from a neurological standpoint, from an anatomical standpoint, and even from a holistic standpoint. We'll dive into what back care really looks like for you, for all of us. And we'll have Dr. Kiti speak to us as to why it's important to even be concerned with back care in the first place. Then Dr. Wail will talk to us about some of the consequences of neglecting your back care. So, Dr. Kiti, what are your thoughts on why we should even be concerned with back care in the first place? We know that everybody complains about their back all the time. And, like I said, we have these silent factors that kind of play into dysfunction at times. So why should we even care about this? Why is this an issue in your thoughts, your words?
Thank you, Dr. Ayanna. So when it comes to back care, right? Here's the truth. Your back is the foundation of almost every movement. You don't think about it, but your back is your axis. Everything happens from around it. Your arms move from your trunk and your spine, your legs, and those nerves that service your entire body travel through your spinal cord, which is the core of your spine, of your back, right? So things that you do, from bending down to picking up your keys, standing in line at the grocery store, your spine and the surrounding muscles are what keeps you upright and moving with ease. Now, when you ignore your back care, people just they just ignore the pain. Eventually, if it's not well taken care of, you can lose function. And poor back care, poor back function can affect your posture. It affects your breathing, your mobility, and as I mentioned before, how your nervous system works and how it communicates with the rest of your body. And so this is why we need small daily habits of healthy back care to make sure you keep your back functioning as much as possible. So just to begin, I just want to give you 3 quick tips because we want to make sure that you leave here with things that you can use today, right now. And so one of my 3 tips is 1, move every hour. We tend to sit a lot more now. We're at desks, we're on computers, we're on phones, we're driving. You need to take breaks and you need to move around. Now, we plan to only have you here for half an hour, but if it's beyond 30 minutes, believe me, we're going to get you up and get you stretching because it's essential for you to break the monotony of sitting down for long periods of time. We have a saying sometimes in physical therapy is motion is lotion. So you need to keep moving to keep those little joints in your spine flexible, well hydrated, as well as the muscles that support it loose and warm so that they can perform the jobs that they need to perform. Then let's go back on to strengthening. You need to strengthen your core daily. And when we talk about the core, people sometimes are confused, but we're talking every muscle that aligns the front of your neck and down, and every muscle from the back, neck, and down. All of those muscles. They're the intercostalis, the little muscles that run around your ribs, the muscles that support your spine, your abdominal muscles, even your pelvic floor is considered core muscles. And as I call the name of those muscles, you probably never gave those muscles thought in terms of being identified to be strengthened as part of your core. We're going to talk more about that. We're going to share more information about that. And then what we want you to do is check your posture. I guess I can almost guess right now as you're sitting down listening to me, you're slumped forward, your head is forward, your shoulders are anteriorly rounded, you probably scooch down in the chair. So we really, really, really want you to pay attention to your posture. And what that means is that when you sit or stand, your air should be over your shoulder, not forward like you're looking over the computer all the time on your phone. And you want your air over your shoulder. Your shoulder should be over your hips. So you don't want to be swayed back like you see sometimes. You don't want to lean forward. And then also pay attention to what your hips and knees are doing. Your feet are your foundation. Are you aligned? Now that sounds like a lot, but we'll break it down for you. We'll talk more about it. And if you have any questions at all as we go through this, please put it in the chat. Our goal is to educate you and inform you. We do not want to lose you with physical therapy jargon. We want to give you functional tips that you can use every day. And so that's my tidbit for right now. I'll hand it over.
Thank you so much, Dr. Kiti. That was very, very informative. And look, as you were talking, I was checking myself. I was like, wait a minute. I'm a little bit slumpish and I have tight hip flexors because I'm always at the desk. I'm always at the computer. So I have to always check myself as well. I'm always in this position typing. So, the head goes forward, you develop the shortening in the I don't want to say circle, but the neck muscles, the upper back muscles. It's very easy for your posture to get off key. And before you know it, after doing that for a full week, a full month, a full year, before you know it, you've developed a pain syndrome and you have no idea where it came from. Dr. Wail, we'd like to hear from you. What do you think about the consequences of neglecting back care? Sitting any kind of way we want, not ever paying attention to what we're doing. What could be the consequences of not taking care of our back? What do you think? And any type of tips that you might have to offer our community today?
Our back, we have to know that. Thank you, Dr. Ayanna. Our back is the most important part of our machine. Our body is like a machine, segmenting your joint. The most bad thing, or the part of our body, of our machine, that's going to tear and wear and will be consumed by the time is the joints. If you say that, if you look to your spine and your back, each vertebrae has about not less than 10 joints. Each vertebrae connected with 10 joints, or maybe more than that in the chest, especially. So a lot of joint means a lot of wear and tear and a lot of consuming. And a lot of joint means that we have very specialized machine in our body. Our spine is very specialized part in our body. It is very essential machine. This spine carries very essential or crucial 5 cavities: the chest cavity, the abdominal cavity, the pelvic cavity, the spinal canal, the cranial cavity. These cavities have the most essential organs in our body. It's life-threatening. This cavity the cavity means volume and volume and pressure. So we have to any problem of the spine could lead to a lot of problems that's life threatening, and even at least it will be engaged with our life. And I want to give you a very simple advice for my back, for our spine. We have a body language, and we have to understand our body language. Our body has a self-maintenance by itself. It can cure itself. It doesn't need us. So, but we have to listen to our body. So, the back has a tissue, the bone tissue, the fascia, the muscles. All of these tissues, its function to withstand the loads. We have the loads, we have the body weight, we have something, we have the weighting, what we are doing. So what we have, two things we have to do it essentially easy. First, decrease the load. Second, increase your strength. Decrease the load you are carrying. You have to lessen your body weight. First, you have to don't do a vigorous work at the day, and see if you carry this one is light, right? It is not harmful for me. But if I carry it for an hour, 2 hours, 3 hours, 5 hours, 6 hours, so it will damage me. So one alignment position for a prolonged time, it will be damaging. Take care for one alignment. And so now we have to listen our body. We have two signs, or we have two talks of our bodies to us, is the pain and fatigue. We have pain is a sign of tissue damage. However, fatigue is a sign of full vanish. With our foliage start to vanish and finish, that means we have fatigue. And then also for the pain, this is a sign, a warning sign of our body. Take care. Your back go to be working. So don't stand the pain. One who stands pain, it means that I stand my body damage, and especially my spine. So take care of your body. And we have two kinds of movement we have to care about them, and we have to do it daily. First, the daily activity. Our daily activity, all of us, all our tissue has a limit. This is a limit of pain at the injury limit, and the limit of fatigue at the full vanish limit. We have done to go to this limit during the day all the time. Move in the comfortable area. You have a comfortable area. You have to move without fatigue. You have to move without pain all the day. But once a day, go to the border, the pain, but the start of the pain. Pain from 1 to 10. After five, pain. After the pain starts from 1, 2, 3, 5. This is a durable pain. After five, it will be damaging pain. And also about the fatigue. Don't go to the fatigue. Once a day, we have to train ourselves to increase our body fat, increase our body potential or maintain it. Also, if we have a bad mal alignment, that means that if you see that this is my head, right? This is my head about 5 kilograms. But if I make it like that, it will be 15. If I'm making it like that, it will be 25. So this is the weight, it will be 25 of my head, but this one is 5. So if you keep good alignment, you will decreasing the load, and at the same time increasing the muscle power, the bone power, the fascia especially, and especially you have our belt of our abdomen and back. This is the thoracolumbar fascia and the abdominal fascia. This is our pelvic lumbar band, our lumbar belt. We have to care about that. We give a lot of age about that, and I want to hear from you any question about how we can talk about the care of our back. Let's see, make it a habit in you. You have to teach yourself step by step, one habit per day, and then perform it and make it persist. Thank you, Mr. and Triana.
Thank you so much, Dr. Wail. What a powerful briefing on the consequences of not being tuned in to your back. I really love the points that you brought forward about how the back is so sophisticated with like 10 joints per level. That is very, very significant, because that lets you know that if you got so many joints per level, per vertebral level, going all the way down the spine, in addition to the fact, like Dr. Wail said, you've got this column that supports the cranial cavity, the thoracic cavity, the abdominal cavity, every cavity, 5 different cavities of your body, every cavity that that your body needs for survival. So, you know, that's a great segue into one of the greatest misconceptions that there is out there about back care, which is if you have back pain, which, you know, you talked to us a little bit about, you know, how we should control our posture and what we should do every day to try and mitigate back symptoms. But a lot of times we're under the impression that if we have back pain that we should just rest. Well, we've just learned that the spine, the most sophisticated part of the back is, and I say the most sophisticated part because you've got, like Dr. Kiti and Dr. Wail have touched upon, you've got so many body parts, tissue, fascia, muscles, cavities, canals, and so on that attach into the spine, that attach into as Dr. Wail said, the weight-bearing, the load-bearing column of the body, in addition to your appendages, your arms, your legs. So if you've got all of these attachments into the spine, into the back, imagine if whenever you're feeling symptoms, you take this misconceived notion that when you feel symptoms, all you need to do is rest. Well, that is simply not true. The truth is, you actually will make your symptoms worse if all you're doing is resting, because when you stop moving, you invite your back to seize up, as the people in the country would say. Your muscles become weak. It only takes 3 days for muscle tissue to begin to waste. So your muscles become weak. And remember, your muscles attach into your spine. Your fascia becomes tight, which means you're going to start losing mobility and flexibility when you become inflexible. It's hard for your lungs to expand. Dr. Kiti told us about how breathing is essential, or back care is essential to fostering your breathing. So if your fascia is tight, your lungs will not expand. Dr. Wail told us that the lung cavity, the thoracic cavity is integral to the back. But if your joints are stiff, all of these 10 joints per level, plus your cavities are tight and stiff because the fascia is tight, you won't be able to breathe properly. Well, you've been told to just rest. That is not a good treatment method. Your circulation slows down. Everything begins to go backwards, so to speak. You're inviting your body to literally become more sick and to become more stiff. And that is not what we want. We do not want a lack in mobility. We don't want your back or your spine to lock up. What is really needed is strategic movement. As Dr. Wail pointed out, as Dr. Kiti alluded to, we want the kind of movement that improves flexibility, that maintains function, that strengthens your core. And both of the doctors talked about strengthening that core, including like Dr. Kiti said, that pelvic floor, which is a very, very important part of maintaining thoracic tension and fostering breathing, because believe it or not, your diaphragm depends on core stability and pelvic strength in order for you to be able to breathe properly. So resting because you have symptoms is not the right thing to do. The right thing to do is to see your doctor of physical therapy so that you can get a program or regimen of strategic movement, not just running out to the gym and trying to get it all done at one time, but knowing what movement patterns are best for you, what type of habits are best for you, and when to implement them. Dr. Kiti, can you tell us a little bit about the difference in the types of back pain? Can you clarify? And I know that you kind of touched on this before. I don't remember if it was you or Dr. Wail, but a lot of times people do not understand muscular pain versus fatigue. I think maybe Dr. Wail touched upon this, but your thoughts, if you had any additional thoughts on helping us to understand pain versus fatigue. I believe it was Dr. Wail that kind of touched on this, but if you have some additional thoughts, I think that our community would benefit from your perspective as well on how we can identify when the back is feeling actual pain versus fatigue. And again, Dr. Wail did tell us, he gave us a scale as to when we reached a pain level of number 5, you are almost at the breaking point of damage, tissue damage. So your thoughts on that topic, Dr. Kiti, if you don't mind.
Sure. So I think the confusion comes that people think it's either this or it's that. It can happen simultaneously, right? When we talk to our patients and clients that are concerned about back symptoms, we usually
Mm-hmm.
ask, so what did you feel first? Some patients will say, well, I heard I had a sharp, searing pain. I had numbness and tingling. I felt like my leg went weak. Or some
Mm-hmm.
people would say it's just a gradual numbing, gradually dull pain that just got worse and worse as time went on. So let's deal with the neurological symptoms first, because they're pretty clear and concise. You can't mix those up. Those look like sharp shooting pain, like the pain that cuts your breath. You have the numbness and the tingling, like a burning sensation. And some patients say to me that, well, if it's in my back, why am I feeling it all down my leg? Well, that's because the nerves that service your legs or the nerves that service your entire body leave from your spine. So depending on where the damage is done, you will feel the pain or the symptoms along the route of the nerve. So a lot of people like to talk about sciatica pain. Oh, I have bad sciatica. Well, sciatica is just one of the symptoms or syndromes that can present. But when you have radiating numbness, tingling, searing, burning pain, that is more indicative or caused by what we call nerve pain or neuropathy, neurological symptoms. Now, with that being said, it's not to say that neuro symptoms cannot cause that dull, achy pain as well. But
Mm-hmm.
those are the signs that we want you to look out for. And those are the ones that we want to be more aggressive in treating, because if you do not treat it, it can get significantly worse. And you can end up with paralysis or incontinence, can't hold your urine, can't hold your stool. So we want to get that dealt with as soon as possible. Those are the ones that get the big red flag right away. Now, the musculoskeletal pain usually happens if you sat for a long period of time and you stand up, you feel a little stiff and achy. If you were trying to do some extra house cleaning more than you usually do, you lift the couch the wrong way, you can feel a little sprain or a strain, a quick pain there, but the pain just stays. And it, like I say, the pain hums and it can get progressively worse. Sometimes it gets better, but usually it gets worse before it gets better, and it can lead into all of these other things, because what your body does when we talk about muscular pain is the body tries to protect you from hurting that area again. And so the muscles will tighten and it would lock down into spasms. The fascia will get restricted because it doesn't want you to do anything to aggravate the area while those muscle fibers are trying to heal. And it's very important to say this, is that Dr. Ayanna mentioned getting good movement early when you've injured yourself, because what tends to happen is that people get very afraid to move because of the pain, and they lock themselves in what we call guarded or painful postures, and that just creates a domino effect of things that happens that could prevent your function, but also could attack your mood, right? Pain and lack of function can cause depression. It can cause anxiety when you think about it causing more pain. If things start to happen like numbness and tingling, you start to get very worked up. And so there's very much a mental component of prolonged pain or back pain, depending on how acute or how aggressive it is. So when you feel the pain, the point that I want you to take home is reach out to somebody who is well versed in the area. You can do the Google search, but you want to talk to a trained professional who sees this every day, who's probably had years of experience with working and learning about how to navigate these different pains, regardless of how they show up. So we can get you through this painful period as fast as possible and get you back to normal function. And so maybe the pain will go away. If we're still having pain 3 to 5 days afterwards, definitely we need to talk about it. If we're having pain a month afterwards, you need to seek help. So do not allow yourself to get encapsulated into these painful guarded postures that could eventually spill over into your mental, your emotions and your mental health and wellness as well. So I hope I answered your question. If you want any more explanation, drop your questions in the chat. Let us know if you experience back pain and how you manage it, because we'd really like to talk with you and really find out how we can best suit your needs and what you're experiencing. Thanks, Dr. Ayanna.
Absolutely. We appreciate that perspective. And yes, to reiterate what Dr. Kiti just said, this forum is really for you. We're introducing the topic, but we really like to know how we can serve you. What are your experiences, the experiences of your loved ones, even any positive stories that may have come about in your life of people who have had issues with their back, and maybe they had great outcomes. We'd like to hear some good news. You know, we always hear bad news, but it's always good to hear good news as well. Don't be like my father. My father was a guy. My father was a guy who he was like, when I take my shower, I don't need to shower my back. I don't see it. So it's not there. So don't be like my father who ignored his back because he couldn't see it. That's kind of foolish. But anyway, he was from the old school, and those guys in those olden days, they didn't always do things that now seem more commonsensical. So please do feel free to engage with us. This is, we're not in the clinic. We're not at work. This is a chat time, and it's for you. We are here for you. This is your opportunity to engage with us and get free information that typically when you go to your doctor, they don't really always take the time. When you go to your medical doctor, they don't always take the time to really dig deep and talk to you and answer questions and help you to solve problems and to think through issues that might be on your mind. You know, those things that come up after you leave the office and you say, oh my God, I should have asked this, or why didn't I talk about that? This time is for you. Dr. Wail, we'd like to hear from you, your perspective. What would you say about the difference between neurological symptoms, musculoskeletal symptoms, anything you want to say about fatigue versus pain, just any icing on the cake that you might feel the community would benefit from. And once again, our friends, we want to welcome you and invite you to please share in the comments so that we can have a discourse, because once we hear from Dr. Wail, we'd like to open the discussion up to you all so that we can answer any questions that you have. Dr. Wail.
Okay. See, when we look to the spine is a joint. It will be complained at any kind of musculoskeletal system, like my knee joint, like my hip joint, my ankle joint. I have vertebral or spine joints. These are the simple joints that could be inflamed and could withstand wear and tear. So we have to care about our joints and see the life of our joint. The joint will be died, the muscle will be died, that fascia will be died if she doesn't move. Because these tissues, the bone tissues, the fascia tissues, the muscle tissue will be respond to the loads. If you have no movement, so you have no loads, so you have nothing to stimulate these tissue to maintain and to grow. So we have to maintain movement. And see what I said to you, whatever I have a problem, I have to respond to my body. All of us, I can move. I have a free painful or pain-free range of movement. I can move with pain. In if I have a range of from 1 to 100, but from 20 to 30 is not painful. So I have to move with that one. Why I don't have to move and in acute case, if you have an acute case and you have a very biggest problem, but you don't have pain, your body is not complaining. So go. If you have a bad thing for you, your body will complain for you. So keep movement. Don't stop moving. When you stop moving, that means you stop growing and the maintenance of your back. And see, we have two things. I said we have the spine. It is a joint. It's a musculoskeletal, like my knee joint, my hip joint. But the difference is the spine. The spine have a pathways, a special pathways for the nerves. And this pathway is a bone pathway. This is a foramen in the bone, in the vertebra, in where net the roots of the nerves going out. When these joints are inflamed and become worse, then these canals and these cavities, I said, it will be narrow and this will compress the nerves. And when you compress the nerves, you prevent the blood supply and the nerve will be die step by step. So you have to keep your spine moving all the time and you have to be away from the pain. And you have to differentiate between your spine pain, your joint pain, and neurological pain. When you go to the neurological pain, so the spine is going. So don't go to that place from the start. Keep your back on. Don't go to the pain because if you go to the pain is a one sign of inflammation. So inflammation means swelling, means hotness, means redness. So by time this B will fibrose and the canals and the foramen will be narrowed And that in that way, all of these pathways will be narrowed and you will compress your nerves and something like that. So you have to differentiate between neurological pain and musculoskeletal pain. You have to correct. And also, I want to tell you a very, very simple habit you have to start to do it for now. You have to know that in this cavity, this is my trunk cavity. You have here the diaphragm, here the pelvic floor, here the internal abdominis. These three muscles, it's three diaphragms. The diaphragm is pushing down. When the diaphragm is pushing down, the abdomen come up and relax forward. Sorry, the abdomen come forward and relax, and pelvic floor come down and relax when the pelvic floor is coming down. At that moment, the pressure in the chest will be low, and the pressure in the abdomen will be high. That means that the air will go easily down here. And also all my venous return and lymph in my abdomen will push up to the chest when the diaphragm is going up. And then the pressure here is high. And so all the blood supply is going out. It will be hard. And also you spill the air out at the same time. You decrease the pressure here in the abdominal cavity. So in the abdominal cavities and pelvic. So it pulls all the lymph drainage and all the venous drainage from the lower limb up to the abdomen until the next breath. So we have a bomb. This bomb, we have to work in this bomb. How to use this pump? Simply breathe from your nose 6 times and inhale from your nose 6 times and exhale 6 times. Like when you inhale for a 6 times from your nose, it's now and long. So like you are blue in the balloon. So you will enlarge your abdomen. You push your diaphragm. So when you push your diaphragm downward, visually your abdomen is going outward and relax your pelvic floor. When you breathe, exhale, tuck your abdomen in, squeeze your pelvic floor like you're catching your boobs, and exhale out. This is now you are working with the bomb. Do it when you are walking, doing when you are sitting. Now that is the best care for your spine and your. But this is a habit. You can do it.
I love that. Yeah.
Yeah, that's it. That's how I talk about abdomen. I want to ensure that this is good, comprehensive, and easy for you.
Mm-hmm. Mm-hmm.
That's it.
Well, thank you so much for that, Dr. Wail. I think they call that, what do they call it? The square breathing method, I think it is. I can't remember the
Yeah,
exact name for it, but it's very powerful using your pump to control the pressures within the thoraco-abdominal cavity. And as you say, it
yes,
all attaches into the back. I do love especially what you said about, it was very, very important, the point, everything, all of your points about the breath control and the spinal joints, how if they become inflamed, the foramina or the holes that the nerves pass through can become constricted. And not only will the nerve supply be interrupted, but the blood supply as well. This is very, very important because you can not only have neurological pain, but you can have vascular pain as well, stemming from the back. And this can become very, very disabling, very, very crippling. And when it becomes chronic, just like Dr. Kiti said, it can bleed over into depression and emotional states, adverse emotional states. This information is so very important. And as I'm listening to both of the doctors, I'm saying, wow, this is a power-packed capsule, like Dr. Kiti said, a capsule of power that, in many cases would have to be paid for at a doctor's visit. And that's only if you know the questions to ask for, because we know nowadays when you make these medical visits, in many cases, you don't get your questions answered. I noticed that we did have a question in the chat. Ms. Sawyer mentioned that she had recently started walking and she began to develop pain in her left hip flexor. And so I'm going to give both doctors a chance to address that in their own way. But I want to say there's so many factors, Ms. Sawyer, that could, and anybody else that has questions, please feel free to drop your questions in the chat. There's so many factors that could play into what could cause left hip flexor or pain in the left lower quadrant to develop. For one, you have your descending colon in the left lower quadrant. And now that you've become active, it could have an effect, a positive effect actually, on your bowel pattern. The colon or the bowels are one of the internal organs that lay directly in front of your spine. They lay also directly in front of the musculature that attaches into your spine. So most people, I'm not saying you, Ms. Sawyer, but I'm saying most people are constipated and don't realize that their colon has material, necrotic, decaying, backed up material that has not been able to move through the canal. And so once that material reaches the tipping point, it can put pressure on those spinal nerve roots that Dr. Wail just mentioned, and it can give you pain radiating into the hip flexor area. It could also be a micro trauma that may have occurred and you may not realize it. You could have made a movement that may have strained muscle tissue. Or it could be that just like many people, I venture to say most of us are walking around with little silent disc bulges. Dr. Wail talked about, he talked about the anatomy of the spine. He talked about these discs in between the vertebral bones. You have these donut-like discs. And so a lot of times when those discs begin to dry out at age 28, we begin to develop changes in the vertebral spine, and you can get little bulges or herniations that could press on nerve roots, and it can feed along the nerve pathway that both doctors talked about, and it can give you symptoms into the hip flexor. But being that you specified that your symptoms are in the left lower quadrant on the anterior portion of your body, I'm more inclined to believe you might have a mild degree of constipation and not know it. I always recommend to people, look, let's just err on the side of caution. It doesn't hurt once a week to make sure that colon is clear, okay? Do take an extra measure to make sure that you're eliminating any pressure from building up that could cause you to have back pain and you not realize that it's coming from one of your organs. Also, it's also a good whole body maintenance technique to make sure you're not developing other somatic problems. And when I say somatic problems, I mean problems that go between the gut and the brain, because you can have a whole host of issues develop based on what's going on in the abdomen. I'd like to hear from Dr. Kiti and Dr. Wail on this matter, if you have an opinion as to what Ms. Sawyer could be facing or dealing with the issues in her left hip flexor, if you have any opinions on that matter.
Certainly. So it sounds very mechanical, right? I was fine, and then I started walking, and then the pain developed in my hip flexor. So I like to look at people as a chain, right? And then one of my biggest go-tos is your feet are your foundation. So first things first, you walk in the door. I'm going to walk and look at the way you walk and the way you move. I'm going to look at your feet, because your feet are your foundation. And if there's something going on with your foot, maybe an old injury, it may be hypomobility or hypomobility. That means too much movement or too little movement at your foot. That dysfunction in your foot could transfer to your ankle, to your knee, to your hip. And it's sort of hard to have that conversation without seeing you and seeing how you move. But that would probably be one of my go-tos. The second thing I would ask you, if you've had any previous injuries to your lower extremity or your back, or if you've had any surgery in that area. Because sometimes you can have scar tissue, as Dr. Ayanna mentioned, your bowels. You can also have scar tissue that could adhere to the fascia of your abdominal cavity, your pelvic floor cavity, and all of that sort of meshed in there so nice and so intricately that if there is some scar tissue, it could aggravate or it can pull on excessively in your hip flexors as you move. So those are two approaches that I would like to go to and utilize, and definitely from there that would give us a good idea or at least rule out some things. And so I'll pass it over to Dr. Wail and see how his approach would also be towards your situation.
Yes, thank you, Dr. Kiti. Regarding this area is most important area. This is as our friend said that this is in front of your head, and this area she defined that it is a flexor muscle. However, in this area we have a lot of things here. We have the hip joint in that area. We have the inguinal lymph nodes, we have the femoral triangular with the femoral nerve, femoral artery, femoral vein. This is a very specific area. Maybe we have the, like Dr. Ayanna said, she had a constipation. All of these things, we have to go to the doctor first and we have to differentiate what is the cause because we have to go against the cause. But I give you a simple solution. You can use it until you will go to the doctor and he will define what is your problem you have. Fine. Start to move in pain-free range. Move. Go on movement. Don't stop moving. Walk in pain-free range. Move your hip joint in pain-free range. The hip joint the joint has two functions. It should be move and stable. It should be have mobility and stability. Move your hip joint in a pain-free range. If this pain-free range increases step by step, so you are going in the right way. If the pain-free range it is not increased, so you have to deal with that. So and also we have to stretch these muscles specifically and those muscles and this specific area in the frontal area. So we have to go through it. Also regarding the constipation. Constipation is a very, very, very bad disease that we have. We have what we said is leaky gut. What is leaky gut? The gut is leakage of all of the poisons, all the bad organisms inside our bloodstream and giving systemic inflammation. So we have to avoid constipation. You have to eat once a day and to get rid of your feed at the same day. This is perfect.
Thank you so very much, Dr. Wail. That is a really, really powerful briefing on the structures in the left lower quadrant and some of the culpability that could be adding to her discomfort. Thank you both, Dr. Kiti and Dr. Wail. Family, this is our time for today, believe it or not. And, as they say, we're not here for a long time, but we're here for a good time. So very much for joining us. In fact, we are here the first Saturday of each month from 12 p.m. to 12:30 p.m. New York, I have some friends joining us, some family joining us from around the world. So New York time, 12 to 12:30. We invite you to like our channel. We invite you to subscribe to our channel. And look, don't be selfish. Make sure that you share it with someone that you care about, whether it be your family, your friends, or even your enemies. So come back, join us again. And thank you for being with us, the Neuro-Wellness Collaborative. I'm so sorry. Thank you. Have a wonderful day, everyone.
I want to say something, Dr. Anna, at the end. Say, if anyone from the Middle East and he want to ask us in Arabic, I am the Arabic translator for you, and I can transfer your idea to us. Thank you.
Not only the Middle East, but if you are from the West and you want Arabic translation, Dr. Wail is your go-to person for that. Thank you so very much. Feel free to join us again. Come back with your questions, like, subscribe, and do share. Have a wonderful day, everyone. Until next time. Bye.
Bye. Bye.